invited to participate in efforts to inform the presidential candidates about our principles that Rich just talked about for quality health care, and to urge candidates to engage in an open and explicit conversation about their plans to improve the healthcare system. For the past several months, in fact, our volunteers have already been visiting presidential campaigns and their offices at campaign events in the early primary and caucus states in Iowa, New Hampshire, South Carolina, and Nevada. And this is part of our Are You Covered campaign. This is a joint effort in which we are working with AARP, the American Heart Association, the American Diabetes Association, and the Alzheimer's Association to make access to care a top issue in next year's elections. Together, our groups represent tens of millions of constituents who depend on a healthcare system that is actually ill-prepared to care for them and to serve them in their time of need. In addition, next spring, the American Cancer Society Cancer Action Network will launch a nationwide bus tour that will, among other things, call attention to the need to improve access to quality health care. This bus, which will visit literally all the 48 continental United States, will educate citizens about the critical need to take action and encourage lawmakers to find solutions to the healthcare crisis. Advocates will also be encouraged to get their federal and state elected officials to sign the American Cancer Society Cancer Action Network Cancer Promise, which outlines short-term steps such as adequate funding for cancer prevention, early detection, and treatment programs that must be taken to get our country back on track toward winning the war on cancer. As you've heard this morning, access to care is extremely, extremely important to help us win this fight against cancer. But we also know that it is only one component of a much broader strategy. That's why we will be continuing to ask cancer patients, survivors, and their caregivers across the country to get active and join our movement in support of all of our current legislative priorities, including increasing the federal investment in medical research at the National Institutes of Health and the National Cancer Institute at a pace that at a minimum keeps pace with medical inflation. We want to give the Food and Drug Administration the broad authority to regulate the sale, advertising, manufacture, and distribution of tobacco products, and a bill is moving through Congress right now that would do just that. We're working to boost tobacco excise taxes across the country, and right now we're calling on Congress to increase the federal tobacco tax, to fund an expansion of the state children's health insurance program, and if you've read this morning's paper, that bill is actually hopefully moving forward with a 61-cent increase, we hope, increasing that funding for federal tobacco taxes. We also want to work to fully fund the Center for Disease Control's and Prevention's National Breast and Cervical Early Detection Program and the state treatment components of that program so that uninsured and underinsured women across this country will have access to life-saving cancer screenings and treatment. And we also want to do a similar thing supporting early detection and treatment programs at the federal and the state level for colorectal cancer. The public education campaign that we launched today adds to the urgency of all of these efforts. Our message to the public is that voters have a critical role to play in improving the healthcare system, and we invite them to join us in this effort. And with that, I'd like to call back to the podium my colleague Greg Donaldson to talk about the advertising and also to introduce Bradley Whitford. Greg.
Thanks, Dan. I was asked to top line for you the elements of the advertising that began today. You may have seen in the Morning Post of USA Today. The print ad over there is running in major U.S. dailies coast to coast today, and the television that you will see shortly begins running this afternoon and this evening. The advertising, as has been said, will air on television, network, and cable television, as well as in print, and a substantial online component starting today and running through the Thanksgiving holidays. Our target audience we consider to be Middle America for this advertising. Registered voters age 35 plus with a household income of $50,000 to $150,000. At the American Cancer Society, we characterize this audience as the worried well, those we believe are concerned about being touched by cancer. These are the Americans who are psychographically predisposed to get involved, to take action, to manage their family's finances, and to manage their family health care. This year has been the case for nearly 10 years now, and the American Cancer Society became the first of the traditional charities to actually consider engaging in paid advertising. Our creative work is the work product of T.G. Madison Advertising, an Atlanta-based agency with whom we have a long and very successful relationship, and we're very pleased by their continued partnership. As has been mentioned once already, the individuals featured in the ads that you will see are real people with real stories. Real people like Raina Bass, who, like has been alluded, knew she had insurance and thought she was covered. As you will find out, that was simply not the case. You'll hear from Raina shortly. For almost as long as the Society has been in the paid advertising game, the voice of the American Cancer Society is a voice well known to all of you, particularly in Washington, D.C., the voice of actor Bradley Whitford, and we are absolutely thrilled to have Brad with us here today. He's graciously worked with the Society for many years now, and has been a supportive person to us. Everybody knows Brad from his 7-year stint on Washington's famous sitcom, not sitcom, drama, West Wing. And
sitcom is real.
From his most, and more recently from his critically acclaimed Studio 60 on the Sunset Strip. For those of you that know anything about Bradley, you know that he's been long involved in issues, social issues that are of great importance to him, and we're pleased that he's shown dedication to our organization and an interest in cancer and cancer issues. Please join me in welcoming Bradley Whitford to the podium. Brad.
Thank you, Greg. On behalf of the acting President of the United States, I'm thrilled to have you. That's, believe me, an old joke. If I pulled out a gun right now and shot you all dead, I would be given access to health care for life. On the other hand, if I worked hard, I got laid off, and my child got leukemia, my family and I would be out of luck. Such is the state of health care in the most privileged country on the face of the planet, and it is a disgrace. It is unfair, it is unjust, and it is deeply un-American. The promise of life, liberty, and the pursuit of happiness is a lie without universal access to health care. Every politician who waxes poetically about a culture of life is lying if universal access to health care is not their most urgent priority. And yes, millions of children are being left behind every day in families ravaged by cancer and other diseases that should have been detected earlier or prevented altogether. I have always been proud to be the voice of the American Cancer Society, but never more so than now because of their courage to state the simple truth that all the research, all the prevention, all the support that is the central mission of the American Cancer Society is meaningless to the 47 million Americans without access to health care. 47 million. 9 million are children, and the numbers of uninsured are going up, not down. They are truly staggering. 18,000 unnecessary American deaths every year because of a lack of access to health care. 6 times the number of deaths caused by the September 11th attacks every year. We must constantly remind ourselves and our elected officials that there is a lethal, slow-motion riot going on in our midst, and we must summon the imagination and the will to put an end to it now. The American Cancer Society's agenda is not to curry favor or to attack for a particular political agenda. It is simply to save lives. This is not a partisan issue. There is no Republican cancer or Democratic cancer. There is only cancer. There is no Republican or Democratic suffering. There is only the universal horror of losing a loved one, especially if it didn't need to happen. We will now, I believe, turn to the videotape and play the spots for you. This is what a healthcare crisis looks like to the American Cancer Society. People with cancer, but without it to cover something as devastating as cancer. We're making progress, but it's not enough if people don't have access to the care that could save their lives. Together, we can change that. Find out what we're doing and how you can help at cancer.org. This is the American Cancer Society.